Hi colleagues and friends, I hope you're all doing well during quarantine. I know schools are not in session, so I welcome any of your children to join my presentation and learn a little bit about what I do. My name is Emily Freeman and I am a registered nurse and CNL candidate completing my master's education at the University of San Francisco. The title CNL stands for Clinical Nurse Leader, which is a master's level prepared nurse who is trained to use evidence-based practice in order to improve quality of care. A CNL is a vital asset not only to the nursing team, but also to other healthcare professionals among multidisciplinary teams. With skills in collaboration and leadership, the CNL is able to identify gaps in care and implement new knowledge and skills to improve patient outcomes. The CNL is able to take a step back from a situation, interpret the nuances that may contribute to unwanted results, and formulate a plan to prevent adverse events or improve quality of care. It is through the conduction of root cause analysis, microsystems assessments, and quality improvement projects that the clinical nurse leader is able to take the initiative to actively shape the structure and system of healthcare practices within the hospital or clinic in which they work, seamlessly integrating the entire care team of physicians, physical therapists, social workers, nursing assistants, and respiratory therapists, and many others, through staff education and policy implementation. I'll give an example the children might be more interested in. Let's say you decided you wanted to go rollerblading, but when you got all ready to go, you didn't put on a helmet or any protective gear. And while you were out with your friends rollerblading, you took a tumble. When you fell, you broke your wrist. The CNL would recognize that there is a problem with the situation and would get to the bottom of it to prevent it from happening in the future. Do you own safety gear in the first place? If not, let's get you some. If you had the safety gear already, why didn't you use it? Is it kept in a place you couldn't reach? Let's make it accessible to you. Maybe your guardian doesn't enforce safety rules about rollerblading, or maybe you just aren't aware of the risks of rollerblading without a helmet and wrist guards and knee pads. We can arrange a safety course so that you can know how to better protect yourself. The CNL takes account of all of these factors and creates a plan that would greatly reduce the chances of getting hurt. So what does this look like in a clinical setting? An example of the work of a CNL would be the integration of evidence-based neonatal skin care guidelines to improve the skin condition of both well and premature newborns. One major role of the clinical nurse leader is to be an advocate for both patients and family needs. Working in the neonatal intensive care unit or any pediatric setting, it is vital to advocate for not only your patients, but for their parents and guardians as well. As a future CNL, I am a leader as well as a team member. I strive to provide the highest quality of care and improve patient outcomes. Now stay safe in your quarantine activities, everyone. Don't forget to wear a helmet, wear your wrist guards and your knee pads. Have a great evening.